Hello, Assalamualaikum warahmatullahi wabarakatuh. Can you all
Dr.
hear
Sam,
me?
Doktor. Hai, Doktor. Apa
Hi.
dengar,
Yes,
Doktor?
doktor.
So what you guys up to? Are you having classes?
We had a briefing for Rota just now, Doctor.
All right. Okay. So do we have everybody in the group already?
A lot of us are actually sharing device, Doctor. So boleh je, Doctor, nak start.
All right. Okay. Good. Okay. Assalamualaikum warahmatullahi wabarakatuh and good afternoon. So the purpose of this briefing is to let you know that for large animal practical session is going to be arranged um, in 4 sessions. Okay, due to the limitations of the current time, first timing, second number of students allowed per session. Therefore, we have the course coordinator, Dr. Roma, have set it into 4 sections. So you're going to be divided into group 1. Well, according to my my nomenclature, it will be group 1A, 1B, 2A, 2B. Okay, but according to Dr. Lokman's punya timetable in the Excel sheet, it's going to be group K1, K2, K3, K4. Correct? So whatever it is, I already uploaded all the materials on Putra Blast. Have you seen the schedule? Dah ke belum? Dah. Okay. Somebody has got to speak to me because I feel like I'm talking to a wall. So usually the class rep will be the one who respond to me. Boleh?
Boleh, Doktor.
Alright. So for this practical, I hope you have got a chance to look at the surgery practical instruction. This is super important. Is this sharing in
Yes, Doctor, we can see your screen.
okay. So this time round for your large animal practical for BPK 3712, you'll get the chance to do hands-on for laparotomy and rheumatology in ruminants. Okay. For this one, usually we offer goats or cattle for students. For this particular session, we only allowing students. We can only offer goats for students for practical. Okay, the goats are being placed in the large animal ward of UVH. Where are the facility that we're going to do this practical? It's going to be at the student standing surgery room. You know the room, correct? And at the large animal ward, depends on situation of cases that we have. If there's so many cases warded, then students have got to do all the surgeries at the student standing surgery room. The training crash not applicable, not on the student surgery room, because this time around we have concurrently small animal and large animal surgery ongoing at the same time. Okay, for the for the first for the group, each of the group is about 30 people. So we're going to start at 10 a.m. Okay. These are the list of materials that are required for the practicals. This will be prepared by the staff, but these are the things that you can ask from the staff during your practicals. If there is, you can ask for gauze, the bowl, but you must check, okay? Whatever that needed here, okay? So these are the things that will be prepared. Okay, I make a point there. Materials will be prepared by staff. Each group must check and ask for materials from staff on duty. Okay. Okay. In a group, this time around we're going to have a small group, 6 people only. Right? If you look at your schedule, the grouping is small, 6 people. So that means you have no one left behind not doing anything. It's going to be super taxing. I'm going to tell you. With large animal practice, if you have only 6 people learning how to do hands-on, that means you are being prepared mentally and physically to be pushed. Okay, so I want you to be mentally prepared, have a good breakfast, and be ready to. Chances are you're going to skip your breakfast, your lunch, because the way that students are doing things are super slow to the point that not even able to finish by 1 or 2 o'clock. Based on our experience, we make it a rule now. 10 a.m. start, by 4 p.m. must finish. Cannot deal after 5 o'clock. That's not fair for all the staff members and for the animal especially. Okay, so that's why you have got to prepare yourself properly. There are only 6 people in the group. Okay, you're gonna hold on. Okay, so you're gonna have main surgeon. Definitely, you have got to have the surgeon. Okay, with 6 people, you're gonna have an assistant surgeon, main surgeon, assistant surgeon. You have got to have anesthetist, but you may not be able to have assistant anesthetist. Okay, 1, 2, 3, 4, 5. Okay, the important people who are going to support you is other people who are going to do the restraining work. Restraining, you need 2 people. Okay, that's where the anesthetist have no luxury of having an assistant anesthetist, but may have a nurse to help. So this is where you've got to, each group, you've got to brainstorm yourself, go through the procedure, go through my lecture note, go through mentally and discuss among yourself, how are you going to do this? Okay, you are going to do laparotomy and then proceed to luminotomy. Okay, siapa tak faham? I'm going to tell you, if you've got to really be prepared yourself. So you've got to have your own discussion before the practical session. So especially the group 1, because you are going to do this on Tuesday next week. Group 1 angkat tangan.
Saya doktor.
Group 1A angkat tangan. Okay, so group 1A, please. In your group already appoint your main surgeon and assistant surgeon. Your main surgeon and assistant surgeon must be the people who must know what they're doing and able to give instruction. Okay, and main anesthetist is usually the organizer. Usually in our surgery setting, it's always the anesthetist who dictate people what to do. Because surgeons have got their own problem. So somebody has got to be a manager. Now that you only have 6 or 7 people in the group, that means you've got to work as a team and be efficient. There's no point of pointing out, why anesthetist, you're so stupid, you don't know how to do this. Or, how surgeon, come, quickly do. Cannot, it doesn't work that way. If we are to finish in time, I want you to finish before 4 o'clock. Okay, we want to be fair to the animal. Imagine this animal is not going to be on general anesthesia. They are standing for you to learn to do your hands on. Okay, so please, I'm going to encourage everybody, each group, please have a discussion to prepare yourself physically and mentally for this hands-on practical. Okay, we offer you the opportunity to do hands-on surgery on the live animals and allow you to take care of these goats until they are healthy and able to be discharged from this practical session. So please help us all. Okay, previous sessions we've got blunder from students, and the effect is on the animals, in which they got into septicemia, they got into peritonitis that leads to septicemia and death. That's not fair. Okay, for your learning, you've got to be responsible for this animal. It's for your, it is for the benefit of you to be able to have hands-on on live animals. Okay, boleh janji?
Boleh doktor.
This is where a group will be challenged. The whole group will be challenged. Okay, we're not going to help you. We're going to just stand there and watch you do it. Okay, and if let's say you are not sure, you need assistance, put up your hand or look for the VOs or the consultant during the session to help out. We're going to have supporting staff, veterinary officer, as well as consultant, that's Dr. Mark and myself, to be there for you. Okay, so but the main point of this exercise is for you to do it. We're not going to dictate you what to do. You yourself decide what to do. So first, what would you do? If you are to do a laparotomy, what would you do first? Guys, we've got only like 10-15 minutes. You've got to respond.
Restrain the animal first.
Cakap kau lagi?
Physical examination first to the
Okay, good point. So here on Monday, okay, for all the groups, Monday, please go and assess your animals at the ward. Speak to Dr. Wan Shukri. Go and find Dr. Wan Shukri to identify where is your animal for that particular week. Then you're going to do your physical examination and assessment one day before the surgery. And then don't forget, in the afternoon you must make sure the goat will be fasted over the night. So you've got to check and make sure the signage for puasa will be put up so that staff pembantu awam will not feed the goats during the night. Why do we want to fast the goats? Kenapa nak kena puasa?
To prevent vomiting after general anesthesia.
We are not going to do general anesthesia. I've told you, the procedure laparotomy and rheumatomy are going to be done on a standing animal. We are not going to GA the goats.
The food in the rumen may contaminate the
How?
site.
How?
Because if we do ruminectomy, laparotomy, and then
Not
because
ruminectomy,
when you're not fast.
ruminotomy. Ruminectomy maksudnya
Sorry,
buang kan.
yes, ruminotomy. So the
Okay.
presence of food in the rumen may contaminate the abdominal cavity.
Yep, especially in the case of spillage. So that's why fast your animals, because as students you are not you are not efficient. That means you are super slow when you are doing a procedure. Okay, so bear in mind here, if we as the people who observe you doing this practical, we see you that you are not competent and too slow, and we don't think that you are able to do the procedure, we're going to back you off. Okay, so you are to proceed for laparotomy. Okay, first, before laparotomy, what would you do first?
L block.
Okay, first you're gonna restrain the animal properly. This is a standing procedure. Ideally, you wanna have the animal standing. Okay, for some group, they opt for the animal to be on lateral recumbency, terpulang. Okay, so you are going to be the one who decide whether you want to do the procedure while the goat is standing, back to the wall and standing, or you want to have the goat on lateral recumbency on a surgery table. You gonna decide. Okay, that's why I told you your leadership and as a group will be tested tremendously under this practical. Okay, and then once you have restrained the animal properly, uh, you want to consider you have got to plan. Satu, nak kena shaving, clip the area first, betul? Skin prep.
betul.
Okay, skin prep, shave, clip dan skin prep. And lepas tu kalau you nak buat on the table, on the lateral recumbency, then prepare the table for you to lift up the goat onto the table, and this is where all the things that you learn about tying knots and all that will become applicable. And then the people who has got to restrain the animal for you. That's why two people restraining the goats on the table. Kalau you nak taruh, if you want to do the procedure on the table. If you want to do the procedure standing on the floor and the goat is standing pun boleh, it's up to you. Depends on the size of your goats. Kalau kambing besar berat 50 kilo, memang selalunya I akan buat standing je. I tak nak on lateral recumbency. Okay, sometimes how do I do it? Cesarean section macam tu. Cesarean section usually I'm gonna force the animal to be on lateral recumbency on the table. Okay, so these are your own decision based on situation you're gonna facing and the temperament of your goats. Okay, lepas shave, clip, skin prep. Okay, let's say we're gonna put it on table. Then you put the goat on the lateral recumbency. Left ke right recumbency?
Left.
Ah, incision kanan kiri.
Incision on the kiri.
Incision on the kiri, doctor. So the animal should be placed on the right lateral recumbency.
Yeah, that's the one. So, animal on the right lateral recumbency because incision is on the left flank. Okay, then tadi dah skin prep betul? Then final skin prep. Then surgeon have got to be, sorry. Usually what I do, you can masa first skin prep, anesthetist can already do the block. Okay, dah clip, shave and clip, skin prep, local block, lepas tu skin prep sekali lagi. So that you anesthesia must remember mana block. Block apa nak buat? I terus bagi tahu straight away ya. Please do L block and 9 block. Dua-dua. Do not dilute your drugs. Please do not dilute your drugs. Biar pekat because you are very slow to the point that the efficacy of the drugs are not effective. And every time you touch the area of paralama fossa, the goat will be struggling. We don't want that. So don't dilute your drugs. Just use the full concentration. There are practitioners who dilute their drugs. But in your situation, because students are super slow, so you cannot dilute your drugs. Okay? So, okay, you're going to be told about the maximum dose of lidocaine. Don't worry. If you have to exceed, just go straight away. I'm a surgeon. I don't care what the anesthetic says. As long as I can get my job done. I need locals. I need my area are fully desensitized so that I can do a good job in terms of incision. So don't worry about the maximum dose. But the vets are going to harass you like mad because they want to make sure that you know there is maximum dose for lidocaine. Okay? As a surgeon, I want to get things done in a fast manner. So that's why I always overdose my lidocaine. So how do I overcome this? Overdosing of my lidocaine? Run fluids after procedure. Just so to flush out the lidocaine. So I'm just giving you the tips. But the vets will harass you about the use, the maximum dose of lidocaine for the purpose of these practicals. So I just let you be prepared for it. Okay? So after you have done your local, L block, line block, and then you can straight away do the incision and then do the laparotomy. If let's say you take too long of a time to do laparotomy and we deem you are not fit to proceed for rheumatectomy, we're going to stop you there. Okay? Because we have had few problems, prolonged peritonitis because the group is not competent and when they proceed for rheumatectomy, there's spillage of rumen content into the abdomen causing peritonitis. Okay, I've got an urgent call, hold on. Okay guys, so settle with incision. If let's say we think you are efficient and you do your laparotomy in a good manner and good time, then we may allow you to proceed for rheumatectomy. Kalau katalah it takes you 1 hour to clip and shave and skin prep the goats, then another half an hour just to put the animal on the table and then deciding whether not to add or whatever it is, cleaning the goats and all that. And then another 1 hour to 1 hour and a half to do laparotomy. No way. There's no way you're gonna finish the whole thing and able to do a rheumatectomy. Okay. So how many minutes usually in practice? Usually when I do cesarean section, it's going to be less than 20 minutes. 15 minutes, shorter than that. Tak boleh panjang. Tapi I understand because you are students and you are learning. So, and we are giving you a big frame of time. Okay, from 10 o'clock until 5 o'clock. But I want you to be able to wrap up the whole thing by 4 o'clock. Okay, because you've got to consider you want to give fluids, you want to do post care for the goats, and most of the time students will wait on the case until 10 o'clock at night to make sure the goats are stable and all that. Okay, any questions so far?
Ada doktor.
Sure. Okay. So please, okay. These are the list of forms you've got to prepare. Okay. Please gather all the forms earlier on. Be one day earlier so that you wouldn't be like a headless chicken looking for things on Tuesday. Because you only have 10 o'clock. 10 o'clock you're already ready to start the procedure. Okay. Not looking for forms and all that. Okay, you've got to do this: anesthetic protocol form, surgical protocol form, daily treatment plan form, because you're taking care of the goats until they are healthy. And if let's say the goats require intensive therapy, fluid therapy, so and fluid administration, you've got to fill up the intensive care treatment form, and also daily progress notes document. You have got to update in the DPN document. And lastly, when the goats is healthy and already ready to be discharged from you as a student group, then you've got to fill up the discharge summary form. Clear?
Okay, doktor.
Okay, next. I think the thing stopped. Okay, so at the end of this, I want you to come up with the surgery practical report. Completions of the written reports, and I want a photographic report of the whole procedure, like starting from clipping until you finish, to record and document your experiences during the practical. And also in the report you have to include cost and expenditure. So everything that you use, the consumables, number of needles, number of syringes, the amount of drugs taken for your goats, fluids given, or prophylaxis drugs given, or NSAIDs drug given, has all to be recorded. And later you will check with the staff member of the price of the materials and the drugs, so that you can calculate how much total cost of the whole project for you. Okay, so this report is to be submitted after the animal is healthy and to be discharged from student's care. Usually it takes about 3 to 4 weeks post-op. For this, provided no complication. Usually in one batch of students, we're going to have 1 or 2 groups that will have complications. So complications can last you up to 1 or 2 months. Sometimes for certain unlucky group, they are taking care of the goat or the cattle until like the whole semester. In the case of septic peritonitis, that means the whole semester you'll be taking care of the goats. Okay, so that's why if you are competent, only we're going to allow you to go for a monatomy to save us the trouble of septic peritonitis. It does happen. It does happen. Okay, so take care. Okay, if we deem you are competent, then only you go for rheumatology. If you feel you are confident and you are good at managing your time and you want to go for rheumatology, please by all means proceed for rheumatology. But in order for you to do that, you have got to be efficient in time management and confident in what you're doing. So that's why preparation for yourself as a group is important. Okay. Next. Any questions so far? Okay. Usually I'm gonna have you all to take photos of your group practical experiences. You're gonna manage this. You need to write a report, so you need to take photo. With 6 people in the group, this is tough job, but you're gonna find a ways to do this. Okay. at the end of this whole thing, okay, subject class representative, Mirai. Okay, all the reports will be compiled and then send the hard copy to me in a file. Please buy your file lah. I tak ada file dah, habis dah. Okay, even though last time I tried to provide files for the student, sekarang tak sempat, nanti you belilah satu file yang tebal tu. Okay, pakailah duit tabung kelas. Okay, in this hard copy, I want you to include all the original forms used for this practical. So I compilekan untuk you. Lagi 10 years after you dah jadi vet, you nak datang balik tengok file-file ni adalah, at least I simpankan. Jadi archive. Aku tak tahu nak simpan kat mana. Simpan je lah file you ni. Okay. And for all the soft copy, to upload your soft copy of your report in Google Drive. Nanti kita discuss macam mana lah nak buat Google Drive ni. Kalau dah ada Google Drive yang sedia ada pun boleh pakai. Please label your report accordingly so that it's a lot easy for us to trace back your reports. EVM4 semester 1 session group berapa? Okay. Semester berapa and session mana? Alright? Jangan tulis tajuk kosong je. Okay. Any questions so far?
Doctor, I have a question.
Yep.
For the surgery, do we wear scrub suits or coveralls?
Okay. Kalau surgeon nak pakai yang mana?
Scrub suit.
Scrub suit. Okay. Restrainer nak pakai baju yang mana?
Coveralls?
Nurses nak pakai baju apa?
Scrub suits?
Okay. Dah sendiri dah boleh jawab kan? Boleh? Lagi ada soalan lagi?
Doctor,
Yep.
for K1G1, there's only 4 group, but then the animal that doctor provided have 5 for each session, right?
Okay, hold on. Hello. Salam dok. Tarikh tengah ada kelas. Kita habiskan ni kejap. Ni pun kelas tiba. Okay. Multitasking like maximum. Okay, apa tadi? I nak share report sebenarnya. Mana report tu? Ni kot. Ni dia. Okay, so this is an example of a report by students. Ni yang baru ni kot, sesi lepas. So they did a that's why I label it as exemplary student report. Okay, sebab dia buat dalam bentuk yang write up yang menarik like a case reports. Okay, so they have the patient, they have the pre-operative assessment, and then they have the about the operation itself, how did they do it, okay, and then how do they manage the whole thing, and then doing the procedure, and then I don't they do they open for monatomy? I tak ingat. Rumen is visible on laparotomy. Okay. Packing the rumen. And they open the rumen. Yep. They did open the rumen and then flush the rumen with saline enclosure, and then anesthetic protocol was described, and then calculations of drugs given here, and then post-op care and management. Okay. Dia suture side the monitor sampai sihat. Okay, and then lastly, cost, price and total cost of the all drugs that they use. So they spend about 320 ringgit for the whole thing with post-op care. That's not bad. Yeah. And then they have discussion about the pre-operative, intraoperative, and the post-operative. So this is just an example, and they have the references. Okay, this is a good report. Yep, this group report is very nice. The practical, yeah, not the best, but that's okay because you're learning. Okay, so I share with you another report by another group. This was boleh lah. Can you see? Tak buka ni.
Tak buka
Tak
lagi.
boleh.
Tak nampak
biar-
lagi.
biarlah dia. Okay, so anyway, any other questions so far? I'm sharing different thing sekarang. What am I sharing?
Permohonan kelulusan mengadakan program TikTok.
Salah. Sekejap, I padam. Stop sharing. Okay lah, dia tak buka lagi tu, biarlah. Okay. CPU usage is high. Dia pun complain. Pakai banyak sangat. Well, anyway, so for the first group especially, you are under tremendous pressure because by Monday you have got to already be prepared for your surgery on Tuesday. So on Monday, don't forget 7 o'clock in the morning for you to do. Please get actually 7 o'clock. Do please get in touch with Dr. Wan Shukri. Boleh? Boleh cari tak Dr. Wan Shukri?
Boleh doktor, I'll email him nanti.
Yes, doctor.
Okay. Cari Dr. Wan Shukri, tanya dia pukul berapa yang you are allowed to do physical examination and assessment and preparation of documents for your goods for the surgery on Tuesday. And communicate efficiently with Dr. Wan. He always pissed off with student because student does not talk to him. He cannot be reaching after you. There's so many of you, correct? You are the one who have got to send representative to talk to him. Do not everybody in the group go and harass Dr. Wan. What you do, send representative, and your representative have got to maintain good communication with the rest of the group. This is why we are sometimes super annoyed with students because information does not travel between classmates, and don't know. I'm so sorry, we cannot accept that. There's so many of you, and we are so little of, so there's not so many of us, so don't drive us crazy. Okay, so help us all, will help you, but you've got to learn to communicate in an efficient manner with the staff member of UVH. Okay,
Okay doktor, thank you.
communication is important here, okay, especially when there's so many people. Make sure you know how to address people accordingly and correctly. Please. And this is your practice as well to be a professional. All right, I need to go. I have my appointment at 2 o'clock and I'm going to be rushing to go to Bangi for my appointment. Okay, anything else? Good luck for group 1 next week. Group 1, after you finish your session, please share with the rest what's your experience so that the next group can do better, so that we all are not going to be overwhelmed with the rest, with the current situation. We are all max Betul tak? Not just the student, the staff member, the lecturer. At the end of the whole thing, we're gonna pull our hair out. If you don't help each other. Okay? Boleh?
Boleh, Doctor.
Alright, good. That's a good motivation. So good luck. Group 1, you memang under pressure. Whatever you do, brainstorm, get yourself prepared. Your leadership skills and efficiency will be tested on Tuesday. Good luck.
Thank you so much, Doctor, for your time.
Okay, bye. Good
Thank you,
luck, everyone.
Doctor.
Thank you, Doctor.
Okay, bye. I end the session. Bye.